Okay, this is a fun episode. We're going back to the West Coast. We got Brett Shore on, who's a hip preservation surgeon. I love his training. It's a really unique path. He's trained at all of the top tier programs his entire career, but yet really wasn't drawn to an academic program. He really wanted sort of the private practice. Went to Kaiser, which is one of the best breeding grounds for young orthopedic surgeons to get reps in very early on in your career. And now he switched over to private practice. I loved our conversation about branding because he's moved out of this internal space. Now he has to really let patients know who he is and what he's all about. He's got an awesome wife who's an anesthesiologist that he works with every day too. It's a really fun episode. I know you're going to like it. Dr. Sigman, hashtag follow the fro.
From medical media, this is The Ortho Show.
Hello, world. Dr. Scott Sigman, your favorite opioid-sparing orthopedic surgeon, here for another episode of the Ortho Show podcast, where everyone knows we bring you the best of the best, and today is no exception. We're going back to the West Coast. We're heading out to Marina Del Rey with Brett Shore, who's a private practice orthopedic surgeon who specializes in hip preservation and sports medicine. He's now a member of a private practice Disc Sports and Spine Center, which is located throughout Southern California. We're going to talk about that. But Brett, it is a pleasure to have you on the show. How are you, brother?
I'm great. Thanks for having me on, Scott. Happy to be here.
Fantastic. We're doing a little swing back to Marina Del Rey. It wasn't too long ago that we had Alexis Dixon on, who I believe is probably in the corner office away from you. So we know the weather's good, so we're not going to have to ask you about that. But look, man, we always start at the beginning of these episodes. We like to know all about you. So
Yeah,
I think you grew up in Philadelphia, but give us a story about where you grew up. Are there other doctors in the family? How did this whole orthopedic thing come for you?
absolutely. So yeah, I grew up in a suburb of Philadelphia called Lower Merion. If the name is familiar, it's very well known out here on the West Coast because I went to high school with Kobe.
Okay, well, there you go. You started
Yeah,
the whole thing for
he was a
Kobe.
year ahead of me.
I love it.
So
I love it.
yeah, so I went to high school just outside Philly. Football, wrestling, usual kind of like sports background. My father is a primary care doctor. My uncle is a neurologist, and obviously this came in later, but my wife is an anesthesiologist, so I'm kind of surrounded by medicine and have been for a long time.
I love it. So we'll talk about that whole work-life balance thing with your
Oh
wife
yeah.
because I know she's the medical director at your surgery center too. I
Yep.
think that'll be a great conversation. All right, so you're in Philly, and you get it early on. You're doing the sports thing, so we can see that. That's a very common theme for a lot of orthopedic surgeons, and it's off to Princeton for undergrad. Were you doing
Yep.
any sports there as well, or was it just all hunkering down for your education?
No, I mean, that was obviously a big part of it, but no, I played football my freshman year. And then ultimately I found myself watching a rugby game, the Ivy League Championships, late in my freshman year. And it reminded me of Braveheart. The guys were getting cut up and taped up and put back in, and it just looked like a lot of fun. So after playing football my freshman year, I ended up leaving the football team and I started playing rugby. And I played rugby for the rest of my time in college and throughout all of medical school as well.
I love it. So I'm going to tell a quick funny story about a rugby player. So I'm learning arthroscopic Latarjet in Matt Ravenscroft operating room in Manchester, England. And we're operating on, on a rugby player. And it just so happened for a couple minutes there was a little bit of hypotension. And Matt looks over at me and says, "Don't worry about it. He wasn't that smart to begin with. He was a rugby player." So I think you're the exception to the rule, that you're out there playing rugby with these kids and getting beat up because that is a tough sport for sure.
It is, yeah, it's funny. My sports before that were wrestling and football, and I never got injured playing football, never missed a football game, never missed a wrestling match. Broke my ankle, broke my thumb, all playing rugby. Yeah,
Yeah, well, at least there's a keg of beer on the sidelines afterwards, I'm
that's
assuming,
the best part.
to help
Yeah.
out to help with those injuries for sure. So Princeton, you do well, obviously. You decide it sounds like you're early on, you're going to medical school, whether or not it's
Yep.
sports or not, we'll talk about that. But once again, Bill Levine gets dragged into another Ortho Show podcast, and
Oh, Bill.
You're off to Columbia Medical School. So
Yep.
at that point, you must have been influenced by the orthopedic department at that point, your sub-Is and all of that, in arguably one of the greatest orthopedic departments in the world.
Absolutely. Yes. I came into medical school knowing that I kind of came in knowing I wanted to be a surgeon. At one point I thought I wanted to be a neurosurgeon. Fortunately, that died off pretty early. But I started talking to a bunch of the different attendings that I worked with in urology and head and neck surgery, orthopedics, and everything. And I came to the conclusion that the orthopedic surgeons seemed the happiest with their jobs. They seemed to really like what they were doing. And I really liked the fact that in orthopedics, we rebuild and reconstruct. We don't generally remove stuff.
Yeah.
And I like that philosophy. I like that part of orthopedics. And then, you know, who are we kidding? Getting to use power tools in the operating room is definitely fun.
And we're demonstrable healers, right? These people come in, they're hurt, they can't do this, they can't lift their arm, their hip hurts, and we can fix them.
Yep,
It's really incredibly gratifying, and it's immediate gratification more often than
exactly.
not, which
It
is why
absolutely
a lot of
is.
people are drawn. So you do a rotation, and then all of a sudden the orthopedic bells and whistles go off, and from there. You're another underachiever, man. You're just like, I gotta go to these lesser programs. Off to the Harvard combined residency you go. Where you're
Yes.
gonna do your orthopedic training. How difficult was it to get into the Harvard program? And tell us a little bit about that transition.
Yeah, so it's interesting. I originally actually thought I was going to try and stay in New York for residency, and was thinking I wanted to go to special surgery. And I met my now wife of 18 years while on a blind date while I was doing a research year at Hospital for Special Surgery. And I met her early on, and she was doing her internship at the now defunct St. Vincent's Hospital. And obviously we hit it off, and she was on her way up to Beth Israel for her anesthesia residency. And so we had a discussion, and I decided I wanted to follow her up there. And I loved the Harvard residency when I went up to interview. And it was a great experience. I mean, the Harvard residency it's an interesting residency because it's pretty big and it's quite spread out. And so it's one of those residencies where it's really what you make of it. There are enough residents and there are enough, like it's spread out enough that for people who aren't overly ambitious, I wouldn't say they can hide, but they can just kind of glide along to some extent. But there are amazing opportunities to work with some like fantastic surgeons at Brigham and Women's, Beth Israel, obviously Mass General, and then we had an amazing 6-month rotation at Boston Children's, which was just an amazing experience.
Yeah, I
So yeah,
mean, arguably, that program has the most diverse subspecialty training,
yeah,
of any program in the country, right? Like you said, you got children's, you got Kevin Raskin, and for oncology, you've got
love
amazing,
Kevin Raskin.
Kevin is just
He's a great guy.
incredible mensch, one of my
Yeah.
favorite people on the planet. And yeah, but you got hand, you got Jesse Jupiter, I don't know who else is there. You got joint replacement, you got sports medicine, I mean, you got it all. I mean, it's amazing the training that you get there for sure.
Jesse Jupiter I rotated with, I was the second year resident on Jesse Jupiter's rotation when I was like early on in my second year. And that was like my wake up call for residency was getting to rotate with him. I still don't, I mean, unfortunately, the amount of hand that I knew then has kind of diminished because I don't take care of hands anymore. But it was an amazing educational experience working with him and seeing his energy level and his passion was almost unparalleled.
So I'll tell you another funny story. It's all about the stories for me. So I'm working with Jesse Jupiter. I've been there for a day. So the Tufts residents, we rotated over for like 3 months
Yeah.
because we needed trauma. So we didn't get enough trauma at Tufts. So that was our goals. We went over there. We were working on the chief resident service, but you had to be assigned to Jesse Jupiter. So the first day, he's doing a carpal tunnel. The chief resident pulls me on the side. He says, we got a hip fracture. You got to come over and help me. I go over. The next day I get called into the office. Jesse fires me because I didn't go to his carpal tunnel surgery. So the chief resident looks over. He's like, "Oh God, everybody gets fired on the first day. You'll get rehired tomorrow." And sure enough, Jesse's become a dear friend, was a dear friend, and just as a great mentor as well.
It's funny you mentioned that because very early on in my rotation, we were doing surgery all day at the surgery center, the Mass General Surgery Center, and it was myself, the fellow, also a great guy, Andy Jawa,
Andy's
really
awesome.
good.
We're going to get him on the
Yeah.
show. He's got,
Oh, nice.
we've had
Yeah.
so many shoulder specialists on the phone, but we owe Andy an episode for sure.
No, he's fantastic. So we're sitting there, and he and I are sitting at the hand table with Dr. Jupiter, and we're operating, and for maybe an hour or two straight, Jesse is just firing questions at me over and over again. And I don't know, maybe I knew like 30% of them. Like, no, I was getting a bunch wrong. And he at one point, his final question was, what road did you take to get out here to get to the surgery center? And I told him, and he was like, I told him what exit I got off on. And he's like, I bet you wish you'd skipped that exit and kept on going, huh, Doctor? Sure. And I was like, oh my God. And then he walked out, and the fellow leans over to me, and Andy was like, I don't think I knew half of the answers to the questions he was just asking. Don't worry about it. You'll be fine.
Oh, that's
And
awesome.
sure
That's
enough, the
like
next day, nothing.
nothing ever happened. That was just
Yeah.
Jesse. He had a short memory for sure. But it's like Mencken breakfasts too. You just survive, right? If you can get through those.
Right.
For sure. So you're like a top tier guy. Obviously, you did well at the Harvard program
Yeah.
too, because then you're off to the Andrews Fellowship for Sports Medicine, which is one of the top tier sports fellowships around. And so, you got to be learning some hip in there too. So you must have spent some time doing some hip arthroscopy in residency because then you did your sports fellowship as well. So tell us about that.
Yeah, so yeah, we did have some we actually did have some very good hip exposure. Boston Children's was probably the best exposure for particularly hip preservation and understanding the hip, because you had young Joe Kim, you had Michael Millis, you had Travis Matheny, all really smart guys, really good hip surgeons. And then Yi Min Yang came in later. You called him Bang, but he came in later. He was a fellow and then like a junior attending when I started, also a really smart surgeon. And it was really just a great opportunity to learn about the anatomy of the acetabulum, understanding femoral and acetabular version, and really understanding the hip in a way that I think it's hard to get if you don't spend that much time with dedicated hip specialists. And then I did some arthroscopy. Min Coker was doing some hip arthroscopy at the time, and he was actually my thesis advisor, also a great guy. And so we were doing some basic hip arthroscopy, but it was interesting because the timing was sort of at the transition point of hip arthroscopy. Because a lot of people sort of refer to 2010 as like the dawn of modern arthroscopic hip techniques. And so my residency kind of crossed over that. And then when I was looking at fellowships, one of the things I wanted to know, because the Andrews Fellowship was an amazing fellowship, it was the educational and the surgical experience was, I think, unparalleled, but they weren't originally known for hips. And so one of the things I wanted to know before I went down there was if I would get a good hip arthroscopy experience. And I didn't even know that I wanted to specialize in hip. I just knew that I should learn how to do it because it was a new field and that there would probably be a need for it. And sure enough, I went down there, and Benton Emblem, who is a tremendous surgeon, he's one of the assistant team doctors for University of Alabama, and he was kind of my mentor a lot during fellowship. My very first rotation of fellowship was with him. And so we did a lot of arthroscopic hip surgery during that time. And that was before we were even closing the capsule. That was when we were doing capsulectomies and whatnot. But it really kind of exposed to me and let me see what you could do with the hip through a scope. Like how much you could see, what kind of pathology you could treat. And it really opened my eyes to the field.
So that's awesome. So I think that is a really good segue, from there, right? It's time to head. You have no problem with geography. I mean, you're going where the best jobs are, right? I mean, a lot of our, I'm assuming your wife was okay too, because she's got to travel around with you too. We got to find her a job,
So
but you're
yeah,
willing to go places, right?
absolutely. It turns out my wife was a Navy brat.
So she
So
was used to it
she
anyway.
lived in 4 or 5 places before she settled anyway. So she was very used to moving around.
All right, so I get it. So and to be a good hip arthroscopist, you really had to try, right? So what was great, you got some exposure, at Children's. You got to understand the anatomy in a three-dimensional way. Then you learn the basic applications of hip arthroscopy. You're getting your reps in, right? You can
Mhm.
you can get into the joint, right? You can see around. You can do things in enough be efficient because they're under traction. And then you take a job at Kaiser Permanente, which I love because Kaiser Permanente is a fascinating place for a young orthopedic surgeon.
Agreed.
You can go, you can tell them what you want to do, and then from day one, they can funnel cases to you to be able
Mhm.
to become a master at what you're doing relatively quickly compared to a private practice where you're sitting around waiting for people to, get your name out so you might do some stuff, right? And so you go to Kaiser and then you're perfecting your hip arthroscopy skills, I'm assuming?
Yeah, no, that's exactly right. When I actually interviewed at Kaiser, I interviewed for 2 different positions in 2 different locations, and one of them was going to be just sport. I mean, not just sports, but one of them was going to be primarily shoulder and knee. Which, to be clear, I actually still really enjoy doing those surgeries. But the other one would allow me to be one of the referral hip surgeons. And they had been looking to hire a new hip surgeon for a while because hip arthroscopy was just taking off. And that was the time Dean Matsuda was there. And the other person who's doing arthroscopy, Monty Katad, they were both there, but the volume was starting to get higher. And so they needed another surgeon. And I ended up taking the job I did because I wanted to build that practice. I wanted to become a competent arthroscopic hip surgeon. And it was great because I did 50 hip arthroscopies my first year out, which
It
is a
doesn't sound
big
like a lot
number
to our listeners. Like my mother Judy's like, well, you need to be doing a little bit more than 50, but that's a lot in your
for
first
your
year of
first
practice.
year, right?
That's a lot in your
Exactly.
first year of practice.
Exactly.
You
Um,
know, I have great respect for hip arthroscopists that will say out loud that they still enjoy and still do knee and shoulder procedures.
yeah,
Because if you really need to be in a spot where if you're only doing hip arthroscopy, either you're doing too many of them or you're in a super referral practice, right?
agreed. Agreed. And
So,
like there are hip surgeons who, yeah, are just, referral from multiple states. And sure, that's completely reasonable. But no, the position at Kaiser was actually a really good experience because first, I was the referral person for hip arthroscopy. And one of the things I learned very quickly was when you are the referral person for hip arthroscopy, you become the referral person for any type of pain anywhere around the hip,
exactly.
lateral hip, posterior hip, like everywhere. And so it actually gave me the opportunity to develop some skills that I hadn't learned before. For example, I had never done endoscopic piriformis releases or sciatic nerve work before I got to Kaiser. I had not done endoscopic hamstring repairs before I got to Kaiser. And ultimately, I had the opportunity to learn how to do those and sort of perfect those techniques as well. So it kind of forced me to become very smart in a relatively short period of time about the hip. But additionally, I happened to come into a practice where there wasn't anyone who did revision knee, who did any like revision ACLs or multi-ligament knee surgery. So I got to keep doing those. And I did all the patella instability too. And I did complex shoulders for 1 year until Dr. Acevedo showed up.
Oh God, Cuff
And
Daddy showed
the
up to the
cuff
big
daddy
house.
showed up and I saw him do, anatomic total shoulders in 40 minutes. And I'm taking an hour and a half. And I was like, I'm
Okay,
going to let him do those.
right. There you go.
I still do rotator cuffs and labral surgery. I still do the arthroscopic shoulder surgery, but it was actually great. I was really happy to have him join on so I didn't have to do like do all that stuff. I was happy to focus on some arthroscopic shoulder stuff and then kind of everything joint preservation for the knee and hip.
Yeah, I mean that's great stuff. I mean, I throw out another great line from Lyle McCaley, who again was
Oh
was
yeah, I love
present when you were
Lyle.
a child.
Yeah,
My
yeah.
favorite line from Lyle is unindicated surgery done well does better than indicated surgery done poorly. So so in the world of the hip preservation, there has been some unindicated surgery that's been done out there. So I'm really happy to hear that your indications are dialed in. We love Danny Acevedo, and we got to give out some more shout outs. Ron Navarro, who is
Oh
just
yeah.
just a king of
Ron's a
orthopedic
great guy.
surgeons. Yeah.
What's interesting was Ron was also part of the impetus for some of the evolution of my hip practice because sometimes, like the piriformis surgery, for example, that was one where a patient had been diagnosed with piriformis syndrome, or we now call it deep gluteal space syndrome, and wanted to go see an outside surgeon because at the time there wasn't anyone who did it. So Ron called me up and asked me, Brett, is this something that you do or that you're comfortable learning how to do? And I hadn't done it before, but I was game. So I did some labs and then I talked to my first patient and I told him straight up, I had
Yeah.
not done this arthroscopically before. I was like, if I'm struggling arthroscopically, I can do it open. And that's a possibility. But that first one went very well. And that kind of took off. And again, anyone who's doing a lot of piriformis releases is probably doing it unindicated. But I would do probably 3 to 5 a year. Not a huge number, but I was the only one
Yeah.
in Kaiser doing them. So yeah, I very much appreciate Ron kind of helping move my advance my practice with some of the needs that Kaiser had.
Yeah, for sure.
Yeah.
And then we got to give maybe a little shout out to Nima Mehran, who's another sports medicine
Oh
orthopedic
yeah.
surgeon within the Kaiser
True.
platform, a K-Jock guy. So always good to sort of give a shout out there too. So what happens though frequently within the Kaiser world? So what a great opportunity for you, right? You got your basic understanding, then you're getting your reps, but what I love too, what I'm hearing from you is you're going to CME, you're going to courses, you're learning all the latest hip arthroscopy
Oh yeah.
techniques and then bringing them back to your patients. So being innovative, the courage to innovate and try new techniques, kudos to you. But then at 10 years, you guys all leave. You
Yep.
get your pension, right? You get this guaranteed salary for life, apparently, for putting in your time and energy. I don't know, but whatever. There's got to be probably a stop time. And then now it's time to go into private practice. And I want to talk about this because it's interesting. You haven't been doing it for too long now. How long you been
I
out
haven't.
doing private practice? Couple years or?
No, I actually so I actually just left Kaiser in February of this year.
Oh, wow.
So
Okay.
I just started in private practice in March. And actually I want to, if it's okay, I want to back up for 1 sec because there's
Yeah, of
one
course.
other thing that I wanted to make sure of that I got an opportunity to do through Kaiser is the sabbatical.
Mm.
Because one of the neat features of Kaiser is once you've been there for 5 years, then you have the opportunity, assuming that you can make it work within the group, to go do a sabbatical, to go learn something new in another location. And I had wanted to, so I was doing all the arthroscopic hip surgery, but I realized that I had a good understanding of the indications for open hip surgery, surgical dislocations, and periacetabular osteotomies and femoral osteotomies, but I had never learned any of those in my training. And I really wanted to. I wanted to try and develop myself into a comprehensive hip surgeon. And so I did a sabbatical in Switzerland about in the summer of 22, where I got to spend the whole summer from like the day my kids left school to 2 days before they started back. The whole
So,
family
so,
moved
so
to
the whole
Zurich.
family. So your wife got a
Yep.
sabbatical out of it too,
Yep.
and the kids go with you. Fantastic. I love that.
Exactly.
I love that
Yep. We were
immersion.
living in
Yep.
Zurich. Switzerland is an amazing country. It's one of my favorite places. And we're actually going back there for the Burn Hip Symposium in April of 25. And I was out there primarily spending time with Mike Leunig, Martin Beck, and Moritz Tannist. And those guys are some of the like godfathers of hip preservation. Both Mike Leunig and Martin Beck were the disciples of Reinhold Gans, who is sort of truly the
The
godfather of
Gons
hip preservation.
osteotomy. I can't remember what
Exactly.
it is, but I remember the dude's name for sure.
That's exactly right. So that's what I was there learning, the Gans osteotomy.
Sure.
And And as it happened, I actually learned anterior total hips while I was there as well.
Oh, awesome.
Yeah.
Yeah. So I think, for our listeners out there, or young listeners that are orthopedic surgeons or going to be, whether you're in medical school, whether you're in your residency training, Kaiser is a fantastic breeding ground for you to be able to develop a career very early on in your practice. They provide a lot of opportunities for sure. I guess the one negative is that there is probably a financial ceiling when you're working in a closed
Yeah.
system such as that. And so that for that reason, you and Cuff Daddy in particular have recently, left the mothership and headed out into sort of private practice. So you're 6 to 8 months into private practice at this
Yep.
point. You're wearing a suit and a tie, and I see you got yourself a nice branded individual website in addition to the
Oh
practice
yeah.
website. That's not by accident. So tell us a little bit about the process you've been doing to brand yourself so that your ideal patients can find you, because there's no competition in LA.
None whatsoever. None. Um, no, so what it's interesting because to be honest, Cuff Daddy was actually like part of the inspiration for me because he left about 6 months before I did. And he had been thinking of it like he left at 10 years to the day. I was there for about 11 and a half years total. And he was a good person to bounce a lot of information off of and about the process. And so in terms of branding and in terms of like sort of getting my name out there, I had listened to your previous one of your previous podcasts with Alexis Dixon, who is great. And she had mentioned how she would go down to all the medical offices at Century City and drop off her card. I did a lot of that as well. I spent my first month or two going to different primary care offices, physical therapy offices around LA, giving short talks, discussing sort of what my philosophy was, particularly in terms of the hip, but other sports medicine stuff as well. And I basically realized that there is a lot of competition in LA, but there are not a lot of people who provide comprehensive hip care. And by that, what I mean is everything from open surgical dislocations and periacetabular osteotomies to arthroscopic hip surgery, soft tissue or endoscopic hip surgery, and anterior total hip replacements. That was a relatively limited niche. And to be honest, I don't think there are that many people who do that like throughout the country. And so that was part of my interest, that I wanted to develop that kind of practice. And so I wanted to build myself and create the brand as sort of a comprehensive hip surgeon. I will give a shout out to one of my other friends who is an excellent surgeon in Nashville, Brian Dierkman, who I learned a lot from as well. And he is one of the other comprehensive hip surgeons that I know and gave me some good pointers in terms of developing that kind of practice.
Yeah, I'm writing a book right now with Matthew Ray Scott. It's going to be coming out in a couple of months. It's with the publisher right now, Physician Brand RX. So I'm always fascinated by how people try to individualize themselves, get
Mhm.
away from the sea of sameness, creating a brand so that your ideal patients can find you. And your brand is wonderful. I mean, it's a concept and idea. It's a niche thing. It hasn't really been done. There's not a lot of people that bring all of that into one space.
Right.
You join a private practice. The private practice is going to do, a lot of stuff for the group, but are they really doing stuff for the individual doctor? So are you taking an active role in the development of your individual practice within this group practice?
Very much, yes. Absolutely.
Tell
Yeah.
us about that, please.
Yeah. So, I've been relatively dormant on the socials for a while. And that was one of the first things that I knew I had to become savvier on. So I had to develop my LinkedIn page and a new Facebook page and my Instagram and all of that stuff. Because that was all stuff that I had spent the 11 years at Kaiser learning everything about how to do the surgery and indicate the surgery.
Everything was given to you. You just came to
Exactly.
work, and every day there was another 40 patients to see, and you had
Yep.
all kinds of surgeries that needed to be done. But
Yep.
now nobody's giving you anything, right?
No. So this was a whole new experience, learning how to and really learning how to present myself as I guess it's a tricky concept to sell yourself without con I'm trying to think of the best way to say this. It's tricky to know how to sell yourself without feeling like a salesman. And that's sort of what I was trying to do. So I was developing the social sites. I was going and, giving the talks and everything. And the group that I am with, though, fortunately, they did have an interest in developing a hip surgeon because
They
the group
want
that
you
I'm
to
with
be
does a
busy.
lot of spine surgery.
You got to cover overhead, right? There's a building there,
Exactly.
right? So we want you busy in things that we're not currently doing. So that was advantageous for you. They're going to support
Exactly.
you. So that's great. And so, it's interesting. I think that, as you're figuring this out, right? It's important to recognize that there's a few things that happen, right? First of all, you are who you say you are, right? You want to let people know what it is. You've trained your entire life to get to this moment to be a master hip surgeon, right?
Yeah.
Then you've got amazing colleagues that you've listed off a dozen names of some of the most impressive hip people that you've trained with and you run in the circles with. So you are who your colleagues say you are. And now you got to get your patients to talk for you too, right? You are what your patients say you are. So
Exactly.
developing that five-star Google rating, having people giving testimonials and saying wonderful things about you, and then sky's the limit.
Yeah, it's funny you mentioned that. So that was and getting all the reviews up. I just recently put up a little sheet in my office with the little QR code to get people to start doing the reviews because obviously all the reviews I had through Kaiser are gone because it's a completely different, Google page. Um, but yeah, and I really wanted to basically mark myself as someone who no matter you don't have to know what's wrong with you when you come to see me. You don't have to, and you're not going to have to go see a bunch of different surgeons to try and figure this out. Like if you have pain around the hip, anywhere around the hip, I am either going to be able to take care of it, or I'm going to be able to identify it as a non-hip problem and be able to have you see, one of our spine specialists or something like that. Yeah.
I'm your guy.
Yeah.
I'm the hip guy. And so, I think that really is, an awesome path for you. I'll give you one little shout out because I want them to be my sponsor anyway.
Yeah.
Social Climb. It's a great website.
Okay.
It's a path that will
Yep.
help to gather your patients, and they automatically get sent out texts to all your patients. So you'll gather reviews for you. Forget that
Oh,
QR
that's great.
code. Social Climb's the way to go. Social Climb, you're going to be a sponsor. You just don't know it yet. Okay. So
Love it.
so we're gonna go to one last thing because we got to get going
Yeah.
here. But I love the work. Always talk about work-life balance. I think that's super important. So what's it like being married to an anesthesiologist that works at your surgery center, and how are you managing the kids?
So great question. I have three daughters, 13, 9, and 4.
You're not going for the fourth daughter, I'm assuming.
I know I am it would be twin daughters. I think we
Mm.
know that's what the next one would be.
Hmm.
I'm 45. I have three. I'm very happy with three. But I have had a couple of people ask me if I was going to go for that boy. Um, but no, it's great. It's being married to an anesthesiologist. First, being married to an anesthesiologist, obviously, who I didn't work with for like she's not with Kaiser, so I didn't work with her for most of the time. And so it was actually really nice because she had the opportunity to ask me questions that she thought might come off as sounding silly about like different procedures she was doing anesthesia for and what kind of pain they would have and what kind of nerve block would be helpful for them. And I was able to ask her questions about anesthesia that I didn't want to ask someone else that I might feel silly. Now that we're working together, it's funny because a lot of people have wondered what would that be like working with your wife. And to be honest, it's actually amazing because she understands what I'm doing. I understand what she's doing. And it is a little bit like what patients hope it's going to be when I tell them that my wife is going to be their anesthesiologist, in that the night before the surgeries, we actually do discuss all of the cases that we're going to be doing. And I tell her what my plan is. We talk about which ones should get nerve blocks and if I anticipate a case is going to take longer or any anesthetic challenges. And so overall, it's been really good. It's funny though, I will admit that probably the first time or two. I'm extremely comfortable in the operating room, but at least the first or second time that I operated for her, it was like the first time I was nervous
That's so
because I was a
funny
resident.
because you don't even know to think about it. But does she have the same last name, or did she keep her
Yeah,
name from medical school? So she does. All right.
yeah.
So they figure that out. But there's just one other great benefit. You get to leave before work. She does. She's got to stick around and wait for the patients to wake up.
I do. It almost feels weird doing the surgery, dressings on, walking out the door while the patient's still asleep.
I
And I'm like,
love
all right,
it.
you deal with this now.
And she's at a surgery center, so there's no call, there's no weekends, there's no crazy nights. So that's great for the kids
Yeah.
too. And so that all works out well. Listen, Brett, this is a great conversation. I really enjoyed myself. And I think it's fascinating on your path because your path to where you are at this moment, you've trained at all top tier programs your entire career. And yet you took a path that's non-academic. You're a healer of people, of regular people. You spent time, in an internal program. You've taken the time to innovate and really become, a specialist of the specialists in a very niche area. It's not an easy path to where you are, and it's one that we haven't heard very often on the Ortho Show. So, congrats to you. You're in a good place, man. I'm really happy for you.
I appreciate it. Thanks, Scott. It's great being on the show. And one more thing I just want to say, Happy New Year.
Yeah, Shana Tova to you as well,
Shana
my
Tova.
friend, for sure.
Yes.
This is Dr. Scott Sigman, hashtag follow the fro, host of the Ortho Show. Till next time.